Good evening, ladies and gentlemen. I'm Claire Kim, your MC for today's lecture. It is my great pleasure and privilege to welcome you all to the 93rd Societas Koreana lecture meeting. Ladies and gentlemen, I'm delighted to welcome Professor Soonman Kwon, who is going to give us an insightful lecture titled Pandemic, Governance, and Resilience. Before we begin, I'd like to briefly introduce Professor Kwon. Dr. Soonman Kwon is a professor and former dean of the School of Public Health at Seoul National University. Holding a health economics expert career over 30 years, he also served the president of the Korea Health Industry Development Institute, which is a government agency allocating public R&D funds to the health sector. Not only for Korean government and public sector, he has been working with many global health agencies as a consultant or advisory committee member in Health Systems Global, WHO Alliance for Health Policy and Systems Research, Global Alliance for Vaccine and Immunization, and WHO Center for Health and Development. And he holds a PhD from the Wharton School, University of Pennsylvania in 1993, and taught at the University of Southern California School of Public Policy until 1996. Okay. Without further delay, please welcome Professor Soonman Kwon with a warm round of applause.
Okay, thanks a lot for inviting me and giving me this opportunity to meet you and give you, have a chance to exchange or examine these very important issues. I'm an academic. So, I spent my entire career after my PhD in academia. But as you know, my main area of research is not a pure science, but rather the analyze policies, impact, how policy is formulated, and also not only in Korean policy, but also health policy at a global level. So I'm a quite unique among Seoul National University professors that so far I had 2 leave of absence. So my first leave of absence is to work at the Asian Development Bank to lead all health sector portfolio there. And I recently had another leave of absence to work in the government agency. The Korea Health Industry Development Institute sounds a bit private, but actually that's a government agency, 100% government budget funded, very similar to the National Institute of Health in the US. So we are a funding agency to allocate government R&D funding to researchers and pharma and device industry. And I recently came back to my office, actually as of September the 1st. I feel so happy to have an early resignation actually, because I miss academia so much. Thank you. I think most of you are very familiar with so far. Already 2.5 years has passed since the COVID-19 has hit the entire world. And this COVID-19 is a pandemic and communicable disease, but it's not just a health problem, as you know. It has a fundamental impact, not only on the health sector, but also the whole socio-economic system. Especially for the health sector, there's so many confirmed infected cases. So many hospitals, healthcare facilities are overloaded with the patients. Especially at the beginning of the system, beginning of the COVID-19, we did not know the nature, or we didn't have a full information and knowledge about the nature of this COVID-19. So we hospitalized all confirmed cases. And then it's overcrowded, and many patients cannot get beds for hospital stay. And we soon after we realized that majority of the infected cases, they do not need medical care. They can just stay without medical care, but they just stay home even, and then they can recover. But it has huge impact on hospitals, caseloaded, and all health system is overloaded. But more importantly, it has a spillover impact. Because when hospitals are fully occupied by these COVID-19 patients, what happened to other essential services? Okay, like cancer patients. I mean, not just COVID vaccination, but other types of essential vaccinations, essential services, maternal and child care. There are huge disruptions in the provision of this type of essential services. So this COVID-19 has not only the direct impact on the COVID-19 related mortality and morbidity, but also the huge, we call it excess mortality, that's happening non-COVID-19 cases because of the access barrier and disruptions in the essential healthcare. And also, it's huge, I mean, for those who need care, especially in the countries that do not have a universal health coverage, they have to pay. Okay? Luckily, in the case of Korea, we have a universal healthcare coverage, so COVID-19 patients, they did not have to pay. But some countries, they have to pay, and there's a huge out-of-pocket payments, and catastrophic payment, or some people become poor as a result of these health issues. But also it has a huge impact on the economy. Okay? Many transportation, public transportation, international travels are shut down, disruptions in the production, distribution, and even a disruption in the production of a very minor item in a very remote area, small manufacturing plant in China has a huge impact in the production of automobile in Korea and other countries. So our trust in the so-called global value chain just disappeared. So, and also as a result of these transportation disruptions, many people, many economy, and especially small economy that depend heavily on the open trade, they suffered a lot. And small, I mean, low-income countries that depend heavily on tourism, they also suffered a lot. Okay? So many people lost jobs, okay? And probably you've seen a story in a TV that Indian government suddenly shut down the whole city. And then many low-income, daily workers, informal sector workers, they lost job. They cannot, I mean, not just lost, but they couldn't come to the workplace. No transportation. And so many people, they worked for 10, 20 days back to their home in the rural area. So that means this huge disruptions in healthcare system and economy means that it's a huge negative impact on human capital. Okay? So that means we have huge negative impact on sustainable growth, sustainable development, and inclusive growth. And this negative impact on human development and sustainable growth will be more visible in the coming years. I'm not just talking about long COVID health impact, but this impact on human development and sustainable growth is not short term. We will see, unfortunately, we will experience long-term impact in the coming years. Like education. Many schools are shut down. I heavily criticize that the school closure was a very myopic, foolish policy, because as you know, the infections for elementary school kids, infection rate is very low. But more importantly, even if they are infected, mortality is almost zero, right? Why should it close, especially the primary schools? But when the schools are closed, I mean, of course, we can use internet-based virtual lectures, but for primary school kids, we are not certain of the impact of this Zoom-based, internet-based education on their performance. More importantly, when school is closed, the kids from high-income family, there is little impact on them. They have their own way. They can mobilize their private lessons. Their parents teach them. But what would happen to the low-income family, their kids? So that means that this school closure, for example, has not only a overall academic performance, but more importantly, I think it's an increasing gap in the academic performance among kids from high-income and low-income family. And the disruption in the primary school like level development will have a lingering impact on their economic performance or their performance in the labor market in 20, 30 years later. So that's the problem, I think. As an economist, I have a slightly different view from a medical doctors, because medical doctors, they pay most of their attention on the number of cases, number of confirmed cases, or even mortality, immediate impacts on COVID-19. But as a policy person or economist, I think that we should pay more attention to the long-term impact on the development. Anyway, so this is a cumulative COVID-19 deaths. Different countries experience different mortality. And in terms of this mortality, I think Korea and Japan did relatively better than other countries. But still, this is, I think, as of April or May this year. So there are even cases of mortalities, deaths from COVID-19 later on. But also this type of statistics, there are a lot of problems because causation, attribution. In some countries, different countries have different classifications or different systems of diagnosis and classify death related, attributed to COVID-19, especially in low-income countries. There are a lot of vital statistics issues. Okay? So there might be some underestimation of deaths in some countries, but overall, this is the picture at the global level. So I'll examine some key policy issues in terms of the government response to COVID-19 pandemic. First, preparedness. Okay? We should have a decent health and socioeconomic system. We call it a preparedness before this type of pandemic happens. Okay? In the case of Korea, the early response to COVID-19 was quite good, I think, in the case of Korea. One very important factor is a preparedness as a result of a good policy learning from the previous experience, I would say previous splendid failure that Korea experienced in the case of MERS, Middle East Respiratory Syndrome. At that time, Korea was one of the very few countries in the whole world that experienced mortalities from this MERS, except for some Middle East countries. So it was a bit a shocking story for many Koreans, because many Koreans or Korean government at that time, communicable disease is an issue of low-income country, but it happened here, and the mortalities happened in one of the best hospital in Korea, Samsung Hospital, Samsung Medical Center. So it was a shameful kind of story. So many people are shocked. But luckily, after this MERS experience, Korean government decided to expand the system for monitoring and prepare for this type of pandemics or serious communicable disease. So government expanded the government agency, government unit working on this communicable disease, and established the Center for Disease Control. So the leadership of this Center for Disease Control played a key role in the recent response to COVID-19. Yeah? And this CDC even expanded during this COVID-19. So now it becomes a disease control agency in Korea. So actually, as you know, most of government ministries, they move to Osong. Osong is like a city. It takes about 45 minutes from Seoul Station to Osong Station, and then you can take a bus to the Sejong city with so many ministries. But in Osong, where the train station, KTX train station is located, we call it a health complex. So government agencies in the area of health are located there, including Korean FDA, Korean CDC, and my agency. So my agency was located right next to the Korean CDC. Anyway, so national and the local national government leadership is quite important, because, as you know, in most countries, including Korea, the first responsibility of handling communicable disease are at the hands of local government, public health centers. Same in Korea. And public health centers are all managed, mainly responsible. It's a responsibility of local government. However, this type of new pandemic, COVID-19 new pandemic, many local governments do not have good information and knowledge how to handle this communicable disease. So in that sense, the technical leadership of the national government is quite important. So in that sense, Korean Disease Control Agency played a quite good job, and especially probably you already heard about I call it director or minister Chung Eun-kyung, the lady. He was quite capable, and he has good experience. He is a medical doctor, but public health training. So she knows public health, and she also spent many years in the government. She has an experience of MERS. So I think her leadership also played a key role. So all the people in that agency, I mean, of course, many others, including myself, we highly respect her knowledge and her leadership. And as I said, technical leadership is important, but still, implementation is at the hands of local government. So good collaboration, coordination between the central government and local government is the key. So of course, I mean, in some countries, I've heard that there is a kind of a coordination failure between central and the local government. But in the case of Korea, that coordination worked quite well, I would say. And in terms of preparedness, I'm saying that government needs to invest in preparedness, like investment in capacity, human resources, like epidemiological investigators, for example, and also key public health functions, including testing. Probably you already know that in the case of COVID-19, mass-scale testing played a key role because it's so rapid infections. So large-scale testing helps us to detect those who are infected, and we can isolate them. So once you are confirmed, it's a requirement for them to stay home, at least stay home for at least for a week. Okay? So that type of isolations was possible, and also public health functions in terms of contact tracing. Of course, contact tracing, as you know, is quite controversial. Okay? But in the case of Korea, it was based on the legal foundation. So communicable disease control law has a specific items to allow this contact tracing. So there is a massive scale contact tracing, and especially at the early stage, we had some failures because government disclosed too many information as a result of contact tracing. But later on, government reduces the amount of information and disseminate only the key information. But still, I think it can be an issue later on, whether to what extent we can sacrifice the privacy for the sake of public health. But I think I did some comparative study, but it is quite true that compared to the European countries, I think that the tolerance of the potential violation of privacy as a result of contact tracing tolerance is a bit high in East Asian countries. But Japan is a bit also exception. Japan is different. Japan, they still do not allow contact tracing. They still, I mean, compared to other part of these Asian countries, I think tolerance level for privacy violation is a bit low in Japan. And also, universal health coverage, like Korea has a national health insurance system, so testing is free, treatment is free. Okay? So I think that type of financial arrangement to minimize the barrier to care, barrier to testing is very important. And also production and procurement and distribution of key materials, testings, like a personal protective equipment, PPE, medicines, ventilators, even like a mobile units or negative pressure rooms, that kind of a thing is important. And many countries were surprised that Korea readily produced a huge amount of test kits in a so short time. It's true, Korea was able to produce so large scale testing kit in so early. But I think, I'm a professor, so researchers are born to criticize. But that means that Korea, the diagnostic industry is too big in Korea. In other words, if you visit a doctor's office, if you visit a hospital in Korea in normal times, you can easily see that they prescribe so many testing. Huh? So, but ironically, that type of so big existing testing industry make it possible to produce this new testing kit in a mass scale. And they were able to export huge amount of testing kit abroad. Because no countries ever, I mean, not, it's a little bit exaggeration, but most countries are not ready to produce the huge, large scale of test kit. So there are some kind of pros and cons and some hidden storyline behind this mass production of testing kits. And also public-private partnership was quite important. Basically, it's not public-private partnership in Korea, it's a private sector dominated. Because I know in many countries, especially low and middle income countries around the world, you depend a lot on the public system for testing, for lab testing. But in Korea, it's a heavily private sector dominated system. More than 90% of hospitals are private. So it's a private sector dominated system. They can readily expand the capacity when there is a potential profit there. So that part is a quite flexible industry structure, I would say, was helpful. Also, vaccination is an issue. Korea was a bit late, I would say, to procure vaccines. But it's not just a Korean case. It's a case for Taiwan, Australia, Korea. Why? Because they relatively did a good job in the containment of confirmed cases in early stage. So they thought that they don't have to procure vaccines very early. And you know, I worked in the health sector for almost 30 years, but I did not even expect that it would take only 1 year before the vaccine is available. mRNA vaccine is available only 1 year. It's a world record. So, and also some, you know, side effect issues. Nobody knows actually. I don't know, because all those vaccines are approved in a special arrangement without long-term kind of a testing things. So because it is so urgent, so I still think that it is a right decision to make vaccines available rapidly with quick, rapid approval around the world. But there are still some uncertainty because it is produced with so, you know, high speed in a sense. But vaccination, I'd like to emphasize the role of global equity. Still, you know, we know that no one is safe until everybody is safe in our fight against pandemic. So many high-income countries, including Korea, it's a shame that many high-income countries were reluctant to make vaccines available to many low and middle-income countries, especially low-income countries in Africa. I think it's a shame. It's a global shame. Vaccination rate, as you can see, there's a huge difference between high-income countries and low-income countries. Is it acceptable? But even among OECD countries, there's a difference in vaccination rate. So in some countries, even if vaccine is available, people do not get vaccinated because of the miscommunication, misperception, overestimation of the risk. I mean, as I mentioned, still, I mean, no vaccine is perfect, no medicine is perfect, no healthcare is perfect. There's always some side effects, potentially. But when we have a cost-benefit analysis, we should get, in the case of COVID-19 vaccination, there is a kind of consensus that even if there's some side effects potentially, but benefit is greater than the cost. So that's why we should get vaccinated. But there are some people still in many high-income countries that they refused. So in those countries, vaccine is thrown to the trash can rather than, you know, provided to low-income countries. It's a shame, I think. Technology and innovation, ICT-based system technology played some role in the case of Korea. As you probably heard, that drive-through testing facility is really a good innovation. It's nowadays all around the world it's being used. So it's a quite important innovations to minimize infections and rapidly perform vaccines. As I said, I came back to my office September the 1st. Before that, my agency that I worked has a lot of global activities. So I traveled, even during this COVID-19, I traveled like 6 or 7 countries. And I had a chance to compare this testing, because before I come back to Korea, I should get the PCR tested. And I can tell you that for sure that really testing facility or capacity in Korea is the world best, and many innovations. And also we have a app such that when I check, I can easily check the information, how many people are waiting in the waiting line for the PCR testing in different facilities. And also, but as I mentioned, contact tracing is still a bit controversial, although I can say the acceptance level of this contact tracing in Korea is relatively high. Because at the beginning of this COVID-19, around the summer 2020, I wrote a small editorial to criticize this contact tracing, because I still think that the privacy is very important, but I got heavily criticized by many people. So it seems that there's general overall high level of acceptance about this contact tracing in the case of Korea. But it can be an issue, so I cannot recommend this type of aggressive contact tracing in other countries. Or we should work harder to introduce contact tracing that can minimize the potential side effects. And also telemedicine is more, the utilization of telemedicine increased in Korea and all over the world, even e-commerce. And I think the education system, still is a good positive impact, in the university level. Because in the university, before this COVID-19, we always use this face-to-face class system, but in a sense, at the university level, face-to-face class is very much of a provider-dominated thinking, right? I'll give you a lecture, I give the lecture, and if you want to listen to my lecture, you should come to this place, right, at the classroom. But sometimes, some students have difficulty coming to the class. So I think that in the case of a university level education, a hybrid form of class seems better. And COVID-19 gave us an opportunity to experience a new modality of teaching. So even like this, we have this ICU, but ICU in some small-sized hospitals, the doctors do not have the capacity to handle the COVID-19 patients. So we use many kind of remote monitoring ICUs, such that ICU in small hospitals in remote area is monitored by experienced medical staff at good university hospital in Seoul, for example. So the remote monitoring in ICU also played a role. Governance. As I mentioned, this COVID-19 pandemic is not just a health issue. It has a fundamental impact on all other sectors in our society. So that means good response to COVID-19 pandemic requires a coordination among different sectors. I'm talking about the coordination among health and economic, social sectors. And as you know, that economic rescue plans played a very important role, save the vulnerable population who lost jobs, who were forced to close their shops. So that kind of coordination among the Ministry of Finance and other ministries played a key role, and coordination among central, provincial, local government is also very important. In the case of Korea, because many local government was not sure, they do not have good technical capacity, most local government, they just follow the guidelines proposed by central government, even the school closure, because as you know, school closure are at the hands of the local government. So, but they in most cases, they follow the guidelines of the central government. But as I mentioned in the case of Korea, I criticize that the guidelines proposed by the central government in the area of primary care, primary education was too strict. I think we should not have closed the primary schools so often. And I think the risk communication is so important. I mean, at the early stage, I think many government, especially Korean government, worked very hard to emphasize, to communicate to the general public that how serious this COVID-19 is. In other words, government tried very hard to persuade the people to take extra caution. Extra caution. I think it worked at the early stage of the COVID-19. However, what we need is a correct estimation of the risk. I mean, what I'm saying is that if we are too much worried about this COVID-19, or if we overestimate the risk of COVID-19, people may be too cautious. Being too cautious has also social cost. It results in the mental stress. It is true. There's increased mobility related to mental problems and depressions as a result of COVID-19. So what I think is that we should provide or try to communicate with the people about a true level of risk. True level of risk. So I think that in the early stage, I think many governments in Europe or in the US, it seems that they underestimate the risk of COVID-19, and Korea seems to be a bit overestimate. But the problem is now it's 2.5 years since the beginning of this COVID-19. I think Korea is still a bit overestimating the risk of COVID-19. Like mask. I think it doesn't have to be mandatory. Of course, nowadays the government is discussing whether we eliminate the mandate of masking, especially in indoor settings. Outdoor settings, mask, we don't need a mask because airflow is so important. So in the outside, with the exception of very condensed, highly populated area, with that exception, it's okay not to wear a mask. Even the PCR test, because we cannot, I mean, the effectiveness of PCR test required when people come back to Korea, when people enter the Korea, I think it recently lifted, fortunately, but it's a bit late, I think. So that kind of thing, I mean, precaution is important. Precaution is important. I'm not saying that we don't have to exercise the precaution. Precaution is important, but if we exercise precaution too much, it may have a bit social cost. School closure is one good example, because people overestimate the risk of COVID-19 in the primary school level. That's why government easily decided to close it. And also social distancing, I mean social trust is very important because like physical distancing, social distancing, it can rely on the voluntary participation. Mandate or legal measures are not enough. So social trust among people, between government and the public is also important for the effectiveness of these social distancing measures in the COVID-19. And I think that the social trust level in Korea during this COVID-19 era was a bit higher than other countries, I would say. Another very important factor is agility in policymaking. Agility, flexibility, and learning by doing. Because I mentioned that preparedness is very important, but this is still a new pandemic. So we can never be 100% prepared. So that means we need a good preparedness. Investment is preparedness before pandemic arrives, but at the same time, we need a good, flexible policymaking system to adjust our policy with more information, more knowledge, more evidence are available during the course of the pandemic. So in that sense, I think Korean government is quite flexible and quick learner, and government officers, they work too hard, I have to say. So when I talk with the officers in the Ministry of Health and Welfare, they said, well, they have, especially in the first year of the COVID-19, there are many requests from other countries to have why don't you have a mutual kind of a Zoom meeting, and they want to learn from Korean case. And after the meeting, the response from other countries said, well, I understand, but we cannot do that because Korean government officers, they work from Monday to Sunday, 24 hours. It's too much, right? I think it's a bit too much as well, because I know many government officers, how they are working. They really work hard. It's a lot of sacrifice, So we should appreciate that. But it's in a sense working too hard, but they were quite flexible. That's true, because when there's new evidence, they're ready to change the policy. And also one example is that at the beginning we hospitalized most of the patients, but when there is evidence is available that we don't need to hospitalize all of them, so government introduced a new concept of facilities, they call it residential or living treatment centers, but there's no doctors there. They just quarantine and put those infected people at individual rooms in the facilities. So that kind of things, or patient triage system has been changing every month following the evidence. So agility is one of the very important aspects of a successful policy. Challenges. I think one of the key challenges or the social cost is equity. As you know, around the whole world, the majority of the casualties in COVID-19, they are from a specific population group. You know that, older people. So mortality rate for kids, teenagers is almost zero. However, mortality in those over 80 years is extremely high. So there's a huge sacrifice in older people and poor people and daily workers. They lost jobs, and they usually, they don't have a good social safety net. And it's not very well documented, but I think that in many high-income countries, there might be a lot of even uneven higher burden on illegal immigrants, right? Like even in Korea, everybody, regardless of legal or illegal immigrant, they are eligible to testing and treatment, but some of them are worried about other issues, so they do not want to get tested even if it's free. Vaccination is free, but all those issues. So those illegal immigrants, I'm sure that they suffered much harder in many countries. And this social distancing was a very important policy measure, but the impact of social distancing is different for different people. Like white collar workers like me, I got little negative impact. Sometimes, because of the social distancing, many white collar workers, they work from home, they spend more time with family. Of course, there might be some increased domestic violence and domestic dispute between family members, but still, but low income, daily workers, they are hit hard by this social distancing. So we should really, I think we should be more concerned about this uneven burden, much higher burden on the poor and vulnerable population that the government policy, including this social distancing policy, had. Okay? And many small businesses, they are closed. Okay? So far, I'm a bit worried about this, for example, suicide, and because suicide is a very extreme outcome of mental health. And unfortunately, the suicide rate in Korea is one of the highest among OECD countries. And then some people are worried about, especially those experts in mental health. They're worried about this potential impact of this COVID-19 in the long term on the mental health issues. And I already mentioned that the school closure was very myopic, inefficient policy. And mainly because not only because of this impact in the overall human development, but more importantly on the potentially increasing gap in the academic performance now, and more importantly in the future. So in that sense, I think that rather than a across-the-board social distancing policy, I think more targeted policy is better. But I understand and I acknowledge that for the first 2 years, it's a really big fight against this COVID-19, and the government did not have enough the resources and time or evidence to craft a very sophisticated targeted policy. Targeted policy means that the government policy targeting the more vulnerable population, more high risk facilities. So we can fine tune the policy measures, even social distancing measures, differently to different population, different facility. But I understand that in reality, it's not easy, right? It's not easy to craft those differentiated, sophisticated policy based on the risk assessment of different facilities and different populations. But I think that now we have more data, and now that our war against COVID-19 is near the end, I think. So we need to get good lessons from this COVID-19, and it's time now for us to analyze those. What kind of policies are more effective than others? What are the costs and benefits of the policy? Because during this COVID-19, we tend to pay more attention on the impact of COVID-19 on the number of confirmed cases, on the number of mortality. But as I mentioned, it's now time to analyze not only the impact of policy on the COVID-related issues, but impact of policy on the education, human development, and economic performance. And then we can be really better prepared for the next round of pandemic, because we know it will be coming again. Because we human beings, we constantly developed, we have developmentalism, we constantly invade those arena of animals. Okay? So nowadays, we call it one health concept. Not just human health, but human health, animal health. So we need a good one health concept. But unless we human beings change our paradigm of development, I'm sure that we'll soon face another round of pandemic, even in the very near future. So we should be better prepared. I wrote a few papers on this issue. This is comparative policies on the COVID-19 in Asia and Pacific. And this is about Korea. This is based in the early phase success on the COVID-19 in the case of Korea, because especially in the early stage of COVID-19 policy, Korea did quite well. And this is also based on the Korean case published by World Bank. But also I think that what kind of perspective we need regarding this COVID-19. Korea was quite successful in the very early stage in the containment of mortality. But at the later stage, we had a huge confirmed cases. So if you examine the total confirmed cases for the 2.5 years, probably there is little difference among countries. But I think so there's little difference in terms of the overall number of confirmed cases, but in terms of the mortality, Korea is much lower. Why? Because at the very early stage, the severity, mortality of COVID-19 is very high. But later on, the mortality or severity of COVID-19, especially with variants, is much lower. So it's not only the total confirmed cases, but at which phase, how many confirmed cases, at which phase is very, very, very much important. So in that sense, although Korea experienced a lot of confirmed cases recently, like for the last 1 year, however, the mortality is much lower than other countries because for the last 1 year, the severity of COVID-19 is much lower than at the early stage of the development. But it's infectious disease. Maybe as a human being, it will be really over when everybody has been infected at some point of time. I got vaccinated 3 times, but I got infected. But the role of vaccination is not prevent the infection, but it's more like prevention of the severe cases. Okay, so that may be our attitude. We cannot eliminate this thing, but rather we need to find a rational or wise way to coexist with this disease. Thank you.
Thank you. Yes, so valuable, informative lecture. Thank you, Professor. So it's now time to wrap up Q&A session. Please let us give him another warm round of applause. Thank you, Professor. All right, this is the end of today's meeting. I'd like to thank all of you for being with us today, and I also extend my gratitude to the staff of the Academy of Korean Studies who have contributed to make this meaningful lecture. We hope to see you all in November. Now, let us open the banquet for your dining pleasure. Please enjoy the rest of the evening. This has been Claire K. Thank you very much.